You're ready for the coronavirus pandemic to be over, right? But it's not, and there's no clear end in sight. So, how do we cope with the anxiety and even depression that can result? Where our guest tonight is this wonderful, amazing, dynamic woman who's on a mission to help us all figure out how we can get through this pandemic and find peace and calm. Her name is Dr. Asha Shajahan, and she is an amazing, remarkable family and community physician. She figured out how to get through this pandemic herself by coping with the anxiety and depression in a unique way. And she's going to share that with us. But first, I want to tell you a little bit about this amazing woman. She has multiple degrees and she is host of the award winning podcast at Beaumont Hospital called House Calls. She is also a board certified family physician at and medical director of community health for Beaumont Hospital, which is in Metro Detroit, if you're watching from outside of our area. And she also is an assistant professor at Oakland University School of Medicine. She has attended this really phenomenal program at Harvard University, where she learned how to use her medical knowledge as a journalist. So she merges media and journalism, and she's been published in national publications. And she also is an award winning diversity advocate. And she also is very committed to helping underserved populations, including homeless people. I want you to meet here on Boss Up Goddess tonight, Dr. Asha Shajahan. Welcome, Dr. Asha.
Thank you, Elizabeth, so much. That was way too big of an introduction. Thank you for having me. I just wanted to hide, but thank you.
Well, you're so welcome. I'm honored to have you here because I know you and I consider you a friend. And then I read your bio and I'm like, oh my gosh, that was only this much of it, everybody. Okay. She does so much and she's very humble. But her message tonight really is all about helping us all figure this out. So let's just start. She's been working on the front lines as a physician during the coronavirus pandemic. She's seen some things we probably can't even imagine. And so she's here to help us cope as well based on something she discovered. So, Dr. Asha, can you tell us about how you decided to figure this out for yourself?
Yeah. So I think when the pandemic started, all of us were sort of like, what is going on? Like, how long is this going to go for? Is this real? Is this not real? There was a lot of uncertainty. And then as things just started shutting down, I mean, my clinic itself was shut down. Like, we weren't seeing patients. We were trying to get up on video. And I normally do homeless outreach, and they had shut down as well. And I was kind of like, everyone's starting to get super anxious about what this means. People are running to the grocery store, buying toilet paper, stocking up. And as I'm watching the news and seeing what's unfolding and starting to realize that this is going to be a pandemic and this is going to last several months, is what I thought at the time.
Mhm.
I started thinking immediately, like, what can I do to help? Where can I be of service? And that is something that I think I've always used throughout my life. When I feel really stressed out, I immediately turn to, what can I do for others? Because what I noticed is, like, when you start thinking about everything that's going, you're like, oh my gosh, oh no, I'm not going to be able to travel. Oh my gosh, I'm not going to be able to get my groceries. Oh my gosh, I'm not going to be able to see my family. It's all I. You start freaking out. So I
Mhm.
always try to turn the I around to, what can I do for other people? What
Love
can
it.
I do to help move us along this pandemic? And so that's sort of what I did. I stepped up. I went and worked in the COVID unit. I worked weekends, nights, 12-hour shifts. I, reached out to the homeless shelter and said, hey, do you guys need me there? Who's looking out for the homeless? Are we screening the homeless? What are we doing? So I reached out there. And then when we started back up on our video visits at work, I was working as well. So it sounds like, oh my gosh, you're doing a lot of things. But to me, it gave me purpose. And for
Mm.
me, it gave me this sense of control, actually. So sometimes when we have anxiety and depression, we just feel like everything's out of our control. and there's nothing that we can do, and we get in this like downward spiral.
Yeah.
And what I find is that when you start putting your focus outward rather than inward, you
Mm-hmm.
start feeling some sense of control.
Mm-hmm.
And then you feel like you are contributing to something greater than yourself. And that always boosts my endorphins.
Oh, I love it. It's a helper's high, right?
Yes, absolutely.
Mm-hmm.
If you've never, like, if you're one of those people that really haven't done a lot of service, I really challenge you to try it, even if you feel like, oh my gosh, what is she talking about? Like my plate was full during the pandemic. I'm taking care of this. I'm taking care of that. Now she's telling me to volunteer or do something. Like, I don't want to get COVID. I don't, like you start freaking out and thinking all these things. But really think about what is it that you can do? Maybe it's, dropping off a meal to a neighbor. Maybe it's checking on someone who hasn't gotten their vaccine yet and seeing, hey, do you need help to just register? I mean, there's little things that you can do from home that
Mm-hmm.
don't really take a lot of time. And it's so rewarding when you see that sigh of relief on the other person's face.
Oh, beautiful. I love that you're saying this, that we don't have to be a physician or we don't have to be, and do something really grand. The small things can be very powerful. I've found that when I've been slipping into a pity party over the past year, I call someone, especially an elderly person, and it's like sunshine for them. I just, hi, how are you doing? And they're just so happy to get a phone call.
Yes.
So,
And I
it,
love that you said pity party because we all have our own pity parties, right? I'm not saying that I'm sunshine all year round and I'm always gun ho. Like I have plenty of my moments. Ask my girlfriends, they know. But it's like when you start having maybe what I say called too many pity parties, like give
mm-hmm,
yourself a couple pity parties. But then once
mm-hmm.
it starts becoming a daily thing, maybe it's time to shift focus and do something else.
Mm-hmm. Mm-hmm. So I love how you're also very, very committed to demystifying misinformation, and you do that on your podcast and in the articles that you write for places like the HuffPost. So can you please talk about that? Because the misinformation that can be very scary can exacerbate the anxiety and depression that some of us have felt through the pandemic. Can you talk about your commitment to making sure we get valid, correct information?
Yeah, absolutely. It's funny. I sort of stumbled upon that working with misinformation. And it really started happening when the pandemic started. So I was kind of interested in writing. I was writing advocacy pieces about different things, some things about anxiety, depression, things about just regular things that you see as a family physician, right? But then when the pandemic hit and I just saw what was going on in the news and I saw how much it was affecting my patients, I mean, I had people calling me at all times, crying, freaking out, not knowing what to do. Do I wash my hands? Do I not wash my hands? Do I wear a mask? Do I not wear a mask? And it was so confusing. And I
Oh.
felt like, as a physician, that it was my responsibility to clear the air. Like, wait a minute. No, 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 that's not right. This is right. Where did you read that? And then it just really, everything kind of compounded together in a beautiful way. And as you mentioned, like I had done a fellowship before, just before the pandemic actually was still kind of going on when the pandemic started. I started it and it was ending. And we had learned all about misinformation, how it happens, what are the roots of it. But I don't think it really struck me as like, hey, this is a mission that you can really provide service and help
Mm.
a lot of people until the pandemic hit. And so
Oh.
I started writing a lot. And when I say writing a lot, it was to demystify the facts. You may know that I'm part of the This Is Our Shot campaign, which is a national grassroots campaign where the purpose is really to be clear and transparent about vaccine information. So first it was all
Mm.
about COVID information, like what is the virus? How do you stay safe? Well, what's true? What's fact versus fiction? And
Mhm.
then now as the time goes on, it's starting to become even further about the vaccines. And then I can see it taking a bigger role later on when this pandemic is finally over,
Yes.
hopefully,
Yay.
to talk about so many other things. I mean, people get misinformation about vitamins, people get misinformation about weight
Mm.
loss, people get
Mhm.
misinformation on so many things. And
Mhm.
I found it like a very serious role for physicians to play,
Mhm.
to be able to demystify some of these kind of not true facts and help
Mhm.
people make empowered decisions about their health.
Mhm. So how do you do that? Just one-on-one speaking, the podcast, articles?
Kind of
What?
all of the above. So I feel
Mhm.
like, the more information you put out there, the more correct information you put out there,
Mhm.
people can see it. So
Mhm.
writing articles, for example, I just recently wrote an op-ed about the J&J vaccine versus the other two mRNA vaccines, the Pfizer.
Oh.
And so the reason I wrote that is that there was so much misinformation about which vaccine's better. Is it this one? Is it that one? I don't know if I
Mm.
should get one. So it's like,
Mhm.
hey, let's put out the facts and you
Mhm.
decide for yourself based on what I'm telling you or what
Mm.
I'm kind of basically taking all the scientific facts and just putting it in plain English. At least that's what I'm hoping to do and trying to do.
Uh-huh.
And then also the more you do things like interviews, the more you're out there. And
Mhm.
I think the one thing that's changed a lot is that in your office, you can reach so many people, right?
Mm.
Maybe 20 to 22 people I see on a daily basis, face to face. And that's a great encounter. And you've got this intimate environment where you can really talk about anything that the patient needs. But what I
Mm.
found is that on social media and getting out there in the public, writing in national or international newspapers, being on different platforms, you can reach so many more people. Your voice gets not
Mhm.
really louder, but it's almost like your voice gets heard by more people that might need it. And so that's why
Mhm.
I've kind of been investing more time in doing that.
Mhm. I love it. I love it. So, Dr. Asha, what's your message for people who are still scared to get vaccinated?
So I want to say one thing is that the three vaccines that are available here in the United States are very safe. They are all effective in terms of preventing serious illness and death. And that's really what we care about when it comes to vaccines. And so, and in addition to that, it's like we're not going to be able to get out of this pandemic unless we have at least 70% of our population vaccinated. So for people that are thinking like I'm just going to wait and see, it's like we're never going to get there. More variants are going to come up the longer we wait to get vaccinated. So the sooner we can get people vaccinated, the sooner we are to a COVID-free world. So I think more than anything, I'm a family physician. I'm always, promoting vaccines in this that I believe are safe. But I think I've really turned and become a huge vaccine advocate for the COVID vaccine because I want nothing more than being in a COVID free world. And I think all of
Mm.
us want to just get back to normal. The amount of
Yes.
anxiety and depression that is happening because of this virus is enormous. And we are going to see
Mhm.
consequences down the line if we don't get this virus under control.
Mhm. Mhm. So, as the pandemic rages on, we have learned about health disparities, or they've come into the spotlight. We knew they were there already, but they've really been highlighted. So, how does the vaccine, how do people in those underserved populations, like homeless people, how are they getting vaccinated?
Yeah. So actually, for example, at the Pope Francis Center where I do my outreach, most of the guests have already gotten their vaccines. They were,
Oh.
yeah, being a vulnerable population, they were eligible for the vaccines. And
Mhm.
it was so funny to me that they were so excited to get the vaccines. Like I was
Oh.
like, how'd it go? You had your vaccine yesterday? Do you feel okay? And, oh, it's no big deal. A little sore arm. And
Uh-huh.
I was surprised because I have other patients that are like really scared and really worried. And like these guys are rolling up their arms and they're like, let's get this in. So so that's how I get fueled and inspired, right? I'm
Mhm.
always surprised when I do any kind of service at the resiliency of the people that I'm trying to help.
Mhm.
Most of the time, I feel like they're helping me.
Oh, I love it. I love
So,
it.
but yeah, so I think for vulnerable populations, it's really important to get the vaccine. And when you look at things like the inequities in terms of where the vaccines are available,
Mhm.
and who are the people that are getting the right information. I think that's why, as physicians, we really need to make a concerted effort to reach those populations. We
Mhm.
know that there are certain populations, such as the African American population, that is disproportionately affected by COVID than others. So it's
Mhm.
important that that population is vaccinated as well as all the others. So
Mhm.
then we have to have messages that reach those populations. We need to have doctors that look like them, talk to those communities. Like I do a
Mhm.
lot of work in the Indian community because that's my background. And
Mhm.
so I understand like the cultural nuances that might occur and make people hesitant.
Mhm.
We all just need to work extra hard to answer people's questions.
Right. Trust is such a huge factor. And you shared a story about how somebody said, well, if you give me the vaccination, I'll take it because she
Yeah.
trusts you.
Oh my gosh. So do you want me to tell the story? I can tell the story.
Yes, I love it.
So she's one of my like favorite patients. We have a long history together, and she was very vaccine hesitant. She's an African American female, and she kept telling me like, I don't know, doc, about this vaccine, and like we talked about it a couple times, and I didn't push her. I just said, I really think that it's beneficial for you. I got it. My parents got it. My family members got it. She's like, okay. Then she's like, can you give me the vaccine? Because if you give it to me, I'll take it.
Hmm.
And in my office, we're not giving out the vaccine. So I thought, oh gosh, I wish I could, but I can't.
Hmm.
So there was a vaccine drive that was happening. This happened last weekend. And at the vaccine drive, it was for people that were 50 and older who have chronic medical conditions, and she fits in that category.
Hmm.
So I called her and I said, if you want, I can give you your vaccine, but I'm all the way out in Novi, and she lived all the way out on the east side, near the Grosse Pointe area.
Hmm.
So I said, if you want to come, you can come. And she's like, if you're giving it, I'm coming. Her, she probably, I mean, it took her probably over 45, 50 minutes
Hmm.
to get there. And she
Hmm.
came, she was scared. And when she walked in, I had my other friends who were physicians there. Like one of the physicians held her hand, and I was just talking to her as I gave her the vaccine. And it was so funny because she was done. I was putting the band-aid on, and she's like, when are you going to do this? And I said, we're done. And she's like,
Oh
that's
my
it. She was
goodness.
like, that's
Oh,
it. She just kept saying,
wow.
so happy. Like,
Oh,
she had her mask on. You could see little tears coming down her eyes. She was just so relieved because she was so anxious about
wow.
getting the shot.
Hmm.
And then I checked up on her, like, but maybe 12 hours later, 24 hours later, and she was doing well. She said, it's no big
Mm,
deal, doc. My arm's a little sore. So that
that's
was
a,
a success story to me because I thought, oh my gosh, she drove so far just for me to give
oh.
her her shot. But I think it was worth it.
But that's the word there is trust. It's she trusts you. She feels safe with you. You diffused her calmed her fear. That's a beautiful story. I love that. If only everybody could be so lucky to have a physician that they trust and love so much.
Well,
You
I think
know?
that's the thing. I think we need to reach out to our physicians. If you have
Mm-hmm.
a doctor that they know your history, they've known you for a long time. And sometimes people feel like, well, I don't really want to bother my doctor, or I'm afraid to ask. Ask your doctor to dispel some of these myths for you. If you're concerned, make an appointment just to talk about that. There's nothing wrong
Mm.
with that because
Mm-hmm.
it will appease your fears.
Mm. I love that. So, your whole message is resiliency through service. Love that so much. And that vaccination clinic that you talked about over the weekend was one way that you coped and felt better. Can you talk about your thought process leading up to that? Because that's the perfect example for all of us.
Yeah, so like I mentioned, I with this virus, I think I've tried to do as much as I can. So it's like work the front lines, working in the inpatient COVID unit, working the streets where homeless patients are, working in the outpatient where people are being seen in the clinics. Okay, so I feel like I've hit every angle of COVID, and then on top of that, it's like okay, now fighting misinformation by through the media, through writing, through social media. And then it's like, okay, now the vaccine's out. So promoting the vaccine, really trying to dispel fears, doing town halls left and right. I've got a town hall tomorrow. I mean, like I'm my calendar is full of town halls.
What does that mean?
Oh, it's basically like a Q&A where people can ask you questions about the vaccine, any concerns and questions that they have, if they're concerned about side effects. And I think people feel more comfortable asking questions from a social media platform or behind a computer screen rather than, maybe in an office sometimes. And so that's what I get probably 25 to 30 messages a day on my Facebook Messenger from people asking about the vaccines. I have people who I
So,
haven't talked to since high school messaging me, asking me about
what?
the
Oh
vaccine.
my goodness.
So,
Wow.
so leading up to this drive is,
Yeah.
the Kerala Association. It's called the Kerala Club. They are an Indian association that is a nonprofit in the area, they do a lot of service. And so they were doing a drive in collaboration with a few other organizations, really trying to empower like the Indian population to get vaccinated. And I mean, everyone was welcome, but it was, trying to do service for that community.
Mm-hmm.
So I was asked, hey, do you want to help out with that? And I said, yeah, sure, I'll come. What do you need me to do? I'll give out shots.
Mm-hmm.
And so then I was like, okay, now I'm giving the shot. Like, I mean, come on. I'm almost like, gosh, I don't really want to be the face of the coronavirus, but come on. Anything I
Wow.
can do to make this be done. I mean, I want
Oh,
to travel.
yes.
We have this campaign going on, the Sweet 16 kind of like bracket. And so it's like your 16 reasons for wanting the virus to be over. And we were just,
Uh-huh.
I was like, I just want to get my eyebrows done. Like anything. I want to go to a movie theater and feel the stickiness of the floor when you're eating your popcorn. You know what I mean? Like just the things that we could do. I miss it.
Oh.
I think we all do. So
Oh my
anything
goodness.
I can do to serve to bring us to a COVID-free world, I'm there.
Yes, 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 yes. So how do you feel when you see things like Miami and the spring break and
Ooh, yeah. I
uh,
think
the mayhem, mass people outside with no masks on and
Yeah, I think it is scary because as you might have heard, the cases are going up here in Michigan. This is where we're, broadcasting from. The cases have definitely gone up. I think we have the highest number of cases today than we did the entire year so far.
Mhm, mhm.
And I think it's because people are really putting their guard down. And so many people are vaccinated. And if you are vaccinated, it is relatively safe for you to be with another vaccinated person unmasked, and still washing your hands and all of that. But I think now people are thinking like, oh, I'm vaccinated, I can go hang out with my friend unmasked, and they haven't waited the 2 weeks of making sure they have the immunity, making sure they had both vaccines if they're getting the mRNA vaccines. There's a lot of nuances, and it doesn't mean you can go run into big crowds yet either. So I think the cases are rising again, which makes me scared because when cases rise, variants occur. And so if
Oh,
we want to make sure these vaccines are effective against the variants, we need to get vaccinated as soon as possible. And so I think when I see that, my heart does kind of go down. Like I do feel like, "Oh, gosh, guys, no, come
I
on, we're
know.
almost there. Like we're almost at the finish line. Like let's not lose the race." So it is discouraging, but I think it just makes me want to go out there harder and,
Uh-huh.
dispel more myths. It's like, okay, well, if people are doing that, that means we're not doing a good enough job getting that message out there that, hey, guys,
Oh.
we still need to distance, we still need to mask. You have to wait till you're completely vaccinated and 2 weeks after that point. And even then, we're not back to normal yet. We need 70% of our population to be vaccinated to get back to normal.
Wow. And you know what? As the weather warms, especially where we live in Michigan, people are so eager to go outside and to go to restaurants and go to parks and gather and have barbecues outside. So that's what happened last summer. So I'm hoping that people will heed your words and be cautious.
It's so, and gathering outside is probably safer, and we have to keep our mental health in check too. I mean, being cooped up inside, Michigan all winter long, many of us did that. It's okay to go outside and go for a walk. It's okay to meet people distance outside. It's those big crowd gatherings. Like we're not ready for big concerts yet. We're not ready
Mm,
for large crowded gatherings. So
mm-hmm,
those are the things that we need to avoid.
mm,
And then, even restaurants, it's like if you're not, I would say if you're not fully vaccinated, I would probably, you know, maybe avoid or do takeout.
mm-hmm. So if someone's fully vaccinated, are they after the 2 weeks, are they protected from variants?
So it depends on the vaccine. So, for example, the J&J vaccine has been tested against all the current variants that are in the United States
Mm-hmm.
and appears to be pretty effective. The Pfizer and Moderna vaccines, they have not been tested fully against all of the variants that are currently available, but their efficacy is a little bit higher than J&J. So I feel like even with the variants in place, it probably will come close to, a 70 so percent, safety kind of thing against the variants. But
Mm-hmm.
I, for those that are like, well, what's the point of getting vaccinated because there's all these variants?
Right.
That's not what we need to do, because vaccination does protect you. It may not protect you 100% as the more variants come out, but it does protect you. And like I mentioned, the more people that are vaccinated, there's 100% less chance of getting severe illness and dying. And then there's less of a chance of this virus spreading and spreading uncontrollably, and then more and more variants coming.
Mm. Oh, I can't wait till this is over, but I'm so grateful that you're doing this to help us all because you're making a positive and powerful difference. And it's really, really wonderful. I'm fascinated by the work that you do in diversity. Can you talk about your commitment and your award winning work to cultivate diversity in the healthcare field?
Yeah, so I've always kind of been very interested in health disparities, diversity, equity, inclusion, and social justice. I had done my training at Henry Ford Hospital in Detroit, and there was a big focus on that during my residency. And I had an amazing mentor, Dr. White Perkins, who really uh, taught me to see what the social determinants were about and the importance of really embracing in diversity, equity, and inclusion. And so, from a healthcare standpoint, that means like even if you look at the studies that had occurred in the past for women who had heart attacks, right?
Mm-hmm.
All the studies that were done only on mostly white males.
Mm-hmm.
So then, when women were presenting with vague chest pain, more arm pain, more different symptoms than men,
Mm-hmm.
people were like, well, they can't be having a heart attack. And they were misdiagnosed. And so, again, when we look from a medical lens at diversity and inclusion, it includes looking at medical treatments for people of all, race, genders, ethnicities, ages, right? Elderly react to medication different than younger people do. And so that's really important when you're looking at your treatment plans. But I also feel just like in general, when you're looking at institutions, whether it's education sector or business sector, nonprofit, there is so much value to the diversity that we have here in the
Mm-hmm.
United States. We have every culture you can think of is in this country, and we're so blessed to have that. And we can celebrate each other's differences and learn from each other about different cultures. It makes our lives more enriched. And so I think
Mm-hmm.
that the more that we spend time with people who are different than us, the more we can learn not only more about ourselves but more about the world. And it's like we can't
Mm-hmm.
live in this bubble about just my way is the only way, my lens is the only lens. The more you spend time with people that look different than you, talk different than you, have different values than you, the more that you learn, and the more that
Mm-hmm.
your vision expands. And so
Mm-hmm.
I just love anything that improves the diversity of any organization or improves the equity when it comes to treatments and access to things, social determinants, just transportation, grocery stores. I mean, you name it. I think
Mm-hmm.
it's so important.
Mm-hmm. And efforts for diversity, equity, and inclusion for physicians is really important as well because it cultivates empathy for patients who look different than what the
Yeah.
physician might look like. So,
So the biggest thing that I do is implicit bias training. So
ooh,
with implicit bias, so for example, I teach residents at a hospital system. And so residents of all different types. So it could be a surgeon, it could be internal medicine, it could be pediatrics, emergency room. And we do this exercise where we kind of don't really talk medically, but we're just talking about different people in general. And it's hard to explain the exercise, but I guess the point is after I give that presentation, I always get people that stay back and say, you know what? Thank you for that, because
wow.
I never saw it that way, or I never realized that I do have a bias against X, Y, and Z. And
Mm-hmm.
I think it's all about realization.
Mm,
Human beings, we are good people. And I think naturally, we all want to be loved and accepted. We all just, we don't want to hate each other. That's not like the
no.
status quo. And I think hate
Mm-mm.
arises when there's fear, and fear
Yes.
arises when there's anxiety. So it's
Mm,
like we need to control the things that make us scared and confront the things that make us scared. And a lot of times
mm-hmm.
it's the unknown. So if you don't know
Mm,
about a certain culture or a certain group, um, you sometimes naturally may be more scared, or you go by what you hear in the media or whatever, and you're not able to make really formulate your own decision about that. I'll give an
Mm.
example. So, growing up, I grew up in Northville, Michigan. There's not really a lot of homeless people in the area, and it wasn't until college that I really started interfacing with a lot of the homeless population. And I actually used to get really uncomfortable because I didn't understand their social circumstance. Like to me, I'm like, well, what, why, when I was younger, like, why can't you just get a job? And I don't understand, like, how did this happen to you? And it wasn't until I started spending time with the homeless population, just hanging out. So I didn't go as a medical student. I didn't go as a doctor. I just went as I'm Asha. I'm here to hang out and learn. And I would just sit and listen to stories that many of these people had. And the empathy that I had from that really raised because I realized that could be me if I was in that
Mm.
circumstance. If I had the
Mhm.
same circumstance as some of these people, I could
Mhm.
easily be on the street.
Mm.
And it's so easy to judge people when you're not in that situation
Mhm.
and that's not your reality. But
Mhm.
once you start hearing stories about other people's lives and their reality, then you're able to really connect on a different level. So that's an example of if there's a certain population that you don't understand, or don't have in your social circle. Maybe you don't have a lot of friends of a certain ethnic background. I say seek it out.
Mhm.
I didn't have homeless friends, but
Right.
I, I, I sought it. Like I said, I'm going to
Yeah.
learn about this. And then now
Uh-huh.
it's like, I mean, who knew that I'd be, spending time all the time with this population? And I always
Wow.
say they are my friends and family.
Oh, that's so beautiful. Well, thank you, Dr. Asha, for all the amazing contributions on so many levels that you're making to our world. You are truly a gift to all of us.
Thank you, Elizabeth. Thank you so much for inviting me on here. And also thank you for doing this. I mean, people listen to this podcast all the time. And I feel like you are giving people opportunity to learn and grow. And that itself is amazing. So thank you
Oh.
for all that you do. And
Mm.
I'm so humble that you invited me on today.
It's an absolute delight. Thank you so much. And I wish you the best. And after the pandemic is over, we're going to get together and enjoy a meal or do something fun.
Yes. We'll finally go boating like we were saying to do.
Okay.
Right? I want to go boating, but we'll go boating in like Italy or something. It has to be something where I just want to travel. I just want to get out of,
Oh my goodness, yes. Oh, yes, yes, yes. We
okay.
will celebrate. Well, thank you again, Dr. Asha Shajahan, for joining me here tonight on Boss Up Goddess.
Thank you. It was a
You're
pleasure.
welcome. And thank you, all of you, for joining me, Elizabeth Ann Atkins, here on Boss Up Goddess, where I interview trailblazing women like Dr. Asha Shajahan, who are doing wonderful things, sharing their wisdom to help us all live bigger, better, and bolder. If you're getting value out of this program, please do like, share, subscribe, and drop us a comment. What do you think about the message of resilience through service? And how are you coping with the pandemic? Love to hear your comments or questions. You can also follow me on Twitter at Elizabeth Atkins. And remember, boss up, goddess. You have the power. I'll see you next time.